Hello folks, my name's Cummins. I'm the Chief Executive here at UHMBT. Just a few minutes from me today before some of us might be going on a summer break, just to let you know a little bit about where we are currently as an organisation and what's coming next over the next few months. I'm going to start off as I generally do with these briefs, just with a huge thank you. I know there are really mixed messages still in the media about the impact of COVID on us as an NHS and what's happening in our communities and at home. I think it's really clear to me that we're all working really hard, that you're all working really hard, our partners are working really hard to make sure that we're delivering all the services that we should as safely as we can, and we maintain that we're delivering safe access to services and treatment for those members of our community who are suffering with the disease still. So a heartfelt thank you from me, from the board. When I'm out and about, I am hearing a lot from colleagues now about how tired they are, how much they're looking forward to a break, how difficult it still feels. And that's quite difficult sometimes, because if I think about how many patients we have at the moment with us with COVID-19, they're relatively small numbers, much smaller numbers than we'd seen through the first couple of waves of the pandemic. But our environment's really different. So I know that we're trying to recover and restore our services. We're accelerating as part of our Accelerator programme to deliver more services. Because of the way that track and trace is working and that we've had some lockdowns lifted, I also know that we have higher staff absence at the moment because of people being pinged and asked to isolate. So whilst we've got that narrative of smaller numbers, we're trying to do much more activity for our communities, and we've got fewer staff around currently as we work through the rest of the vaccination programme and the new regime for test and trace. So I know it's busy, I know you're tired, I know we're doing an awful lot, and it's a massive thank you from me for all that you do. In terms of COVID, I think it's really kind of exciting for a lot of us that the lockdown restrictions that were lifted on the 19th of July, lots of mixed emotions. I know lots of us are looking forward to seeing friends and family we might not have seen for a while, or being able to do things outside of work that have been off the cards for the last 12 or 15 months. And that's exciting. It's good that we can start to think as a society of coming back to what normal might look like now with living arrangements and arrangements outside of work. But you'll have noticed messages from me, which I'm going to give again today, that hands, face, space message, making sure that we've got good quality PPE and we're using PPE in our clinical areas, that we're all continuing to wear our masks in our communal areas, that we're washing and making sure that we've got good hand hygiene when we're in work, and that we're keeping that 2 meters space away from each other where we can when we're in the work environment. Those messages will stay. I want to make sure that we do all we can as a hospital, as a group of colleagues, as members of our communities, to make sure that we're protecting each other, we're protecting our patients, and those simple messages are the best way I can think of continuing to do that until we don't need to anymore. I talked briefly about recovery and restoration. All of our services now are up and running. I know at periods over the pandemic we've had to stop some services and do them in a different way. We're now at what I would call full chat. We're also part of our ICS's Accelerator programme, with our ambition to do much more activity than we were doing even before the pandemic. And I can't tell you how proud I am of our team. So in the climate I've just described, and despite being really tired, there are many, many hundreds more patients in our communities being treated now than we might have been able to do if we weren't part of our Accelerator programme. And I know when we put our bids in and we were talking about that together, people were worried about whether we had the capacity, whether we could service that level of demand. And whilst we're not quite at the levels yet that we want to be, we are far outstripping kind of national targets on what's expected of us as an organisation, and pushing that activity as best we can. To make sure that we're clearing our waiting lists or reducing the amount of time that some of our communities are having to wait for treatment. Because it's really important that whilst we deal with COVID and the remainder of any waves or the rest of the pandemic, treating patients really well, treating patients in a timely way, that's our business. We want to make sure that we're doing that really well. One last message from me before I close with a thank you is just looking ahead to the next couple of months. So obviously it's the summer months. I know that many of us will have been looking forward to a break of some variety. It is really important that we still do that. I know it might not be the holidays we might have been planning, or the trips that we might have been looking forward to in the way that we might have done without COVID with us. But please don't use that as a, well, maybe I won't take my leave just now. I might leave it a little while and see if things free up a little for different trips or different holidays. That will happen in the future, I've got no doubt. But I really want to make sure that through this period where we've got the opportunity, colleagues are taking breaks. It's really important that we restore, we spend time with families and friends, we get out in the sunshine. It's not sunshining today, has been the last couple of weeks, but it's tipping down behind me. We just need to make sure that we're recovering properly and we're taking that opportunity where we can. There's a couple of things that are coming for us as an organisation in the next month or so. One is the final report from our CQC well-led inspection, which was delivered in April and May. And the other is the outcomes of the urology independent review that we asked NHSEI to commission. It's going back almost 2 years now. So those two reports will absolutely come back to our organisation, and whilst they will highlight areas that we've improved and we've done really well at, and it's important that we recognise that and we can talk to each other about that, it is also going to play back, both those reports, areas that we need to improve, without a doubt. And you'll have seen messages from me over the last month or so about particularly the CQC report, their feedback on our stroke services, around our emergency care delivery at the RLI in particular, and maternity. Those are some of the areas that they're asking us to improve. So be prepared when the reports land. We'll be coming back out to colleagues to say a bit more about that. I know full well that all of our colleagues will be pointed at improvement, addressing the issues that are raised, and making sure that the good quality and safe services we deliver are sustained in the future. So just to be aware they're coming. They're likely to give a balanced view of what we've done well and what we could still improve, and I know we'll make that commitment to do that together. So that's a bit of an update from me, a bit of COVID, a bit of how we're doing as an organisation on recovery, some elements of what's coming next. But it just remains for me to say again, massive thank you for everything that you're doing. A huge thank you on behalf of all of our partners, and from me to our partners, for the work that we deliver together each and every day. Take your breaks, look forward to something in the summer where we can take some time away from work. And I'll make sure that over the next couple of months we do a couple more of these briefings as we get some of that external feedback in particular to keep you all up to date. So a massive thank you. Take care.